Let's talk about the calf muscles and how calf tightness can contribute to plantar fasciitis. The calf complex is made up of two main muscles. You've got the gastrocnemius, which crosses the knee joint and attaches to the medial and lateral condyles of the femur. And the soleus sits directly underneath it, which attaches to the posterior surfaces of the tibia and fibula just below the knee joint. So soleus does not cross the knee joint. Both muscles come together to form the Achilles tendon, also known as the calcaneal tendon, and then that connects to the heel bone called the calcaneus. The Achilles tendon transitions into the plantar fascia, and that's a thick band of connective tissue on the bottom of the foot. But when the calf muscles get really tight, whether it's due to overuse, poor footwear, or drastic increase in activity, that can pull the Achilles tendon up and compresses the joint space between the calcaneal tendon, and then over time it changes your biomechanics, and you might start limping, putting excessive pressure on the heel, and that over time causes pain. So when it comes to addressing plantar fasciitis, and because most people notice this pain at the bottom of the heel first thing in the morning, it's important to stretch your calf muscles. So keep these muscles as loose as possible, and also do some ankle mobility and using a spiky ball to ensure there's adequate joint space around the calcaneus bone. But also, tight calf muscles can make you more susceptible to developing Achilles tendinopathy, calf strains, and other overuse injuries. So it's really important to stretch, use a spiky ball, but to also do both seated and standing calf raises, because the seated calf raises will strengthen the soleus, and then standing calf raises will strengthen the gastrocnemius because it crosses the knee joint.